Greetings from Citizen Health Team under Academia IAIMS eConnect. And as we all know that we have initiated a series, People's Health, It Matters. And for this, today we have a prominent speaker, Dr. Rashmi ma'am. And warm welcome to you ma'am on behalf of all the audience.
Thank you. Thanks a lot.
Dr. Rashmi ma'am is an additional professor in Department of Community and Family Medicine in All India Institute of Medical Sciences, Bibinagar, Hyderabad. Today we are going to talk on a topic diabetes that I feel that is a very common disease nowadays. Like in every fourth person in 100 of them have diabetes. So it will be very interesting session with you, ma'am. Again, I just welcome you on the behalf of all the audience.
Thank you. Thanks a lot. Yeah, of course, it is an interesting and ought to be known topic. So let's have some more discussion and let people know about it.
Sure, ma'am. Let's start with this term diabetes mellitus. What is the importance of diabetes mellitus in India?
Diabetes in India. It is expected that in year 2045, India is going to be the highest with diabetes, with 134 million of people in with diabetes. That means India's population. It is going to be. It is called as the diabetes capital of the world, and by 2025, 80 million of people will have diabetes. That is expected. So there would be an increase of 266% of diabetes in India. And that's very much alarming. And all of us should be knowing that it can increase, and we have to be in a mode of prevention from now so that it does not increase. We all know diabetes has a lot of complications, and Asians actually are in a major threat of getting into diabetes. So that's the importance that India has with diabetes, and we should be more aware of this disease.
Ma'am, what is the diabetes status in the world?
Okay, world has also seen that it is an increase globally. The burden of diabetes has been increasing. It was 108 million in 1980s, and it is 422 million in 2014. Look at that, how much it has increased. The prevalence has been increasing rapidly. And more important to know is the low and middle income countries are having high diabetes as compared to high income countries. Why is this important is low and middle income countries have problems in managing the diabetes complications, as the healthcare in those countries are in a state, whereas high income countries can manage it. But we are seeing an increase in low and middle income countries. That's the global outlook of diabetes. And all of us know diabetes is a major cause for blindness, kidney failure, heart attack, stroke, lower limb amputation. So from 2000 to 2016, that is around 16 years, there was 5% of premature death in diabetes among all over the world. In 2019, 1.5 million deaths were directly because of diabetes, and another 2.2 million deaths were contributed because of diabetes. Means because of high level of blood sugar, something else was caused and it caused death. So it is very alarming globally to know that. So the diabetes has increased its incidence, prevalence by 102%. It has become totally from 1990 to 2017. The DALI, that is disability adjusted living years, that is disability adjusted, the disability because of diabetes has increased another 80%. So that says that the whole world is having a problem of diabetes, and major diabetic problem we see in low and middle income countries. So, and it is estimated that global burden, which was 9.3% in 2019, will become 10.9%, nearly 11% in 2045. This may look as 2% increase, but this 2% will be millions of people all over the world will be suffering from diabetes. So globally, just under half a billion people are living with diabetes worldwide, and number projected is 25% increase in 2030 and 51% in 2045. Half a billion people are already living with diabetes. That's an importance globally, if you see.
Oh, ma'am, as we all know that diabetes is two types, is of two types. So, which type of diabetes we are today talking about, and what is
We are
this?
talking
What
majorly on, yeah. Uh, I didn't get your second part. Which type
what
I
are
came to know after that?
these
The
two
types,
types?
type 1 and type 2 diabetes are the two types of diabetes. Type 1 diabetes basically is two-line diabetes, majorly because of hereditary, and we get in the earlier age, whereas type 2 diabetes is majorly, it's not exactly, but though it is genetic, majorly because of lifestyle modification, and we see it in the adults and elderly. And if you see, from 1980 or from 1970, type 1 diabetes has remained the same. It has not have had any increase. Whatever I am speaking about is in the increase of type 2 diabetes. Actually, type 1 has decreased a bit of it. It has decreased by 0.98%, almost 1%. It has decreased, whereas type 2 has increased double folded, and it was going to be three folds in the future. So the whole world diabetes majorly contributes to type 2, which is major entity because of lifestyle. Of course, genetic has an underlying with that, but major entity is of the lifestyle, what we are eating it with. So that's the importance to know that our lifestyle and our living pattern, which can be prevented. Type 1 is difficult to be prevented. It is preventable but difficult to be prevented, whereas type 2 is an easy preventable disease. More than intervention, prevention is much easier, which has to be looked into, and that is increasing. So we have given a very less importance to the prevention. Means we have changed our lifestyle in such a way that we are going into a disease mode continuously. That has to be looked into.
Okay, so type 2 diabetes is basically a lifestyle disorder. If we manage our lifestyle, then we can prevent diabetes mellitus. And ma'am, if parents have diabetes mellitus, type 2 diabetes, if parents have, then but his child prevent, like he does yoga and balances lifestyle, then is there any chance to have a diabetes mellitus or not?
The chances of, see, we all know that diabetes, of course, as I agree, like type 1, type 2 is also genetic disease. But imagine you have a genetic predisposition, but getting a diabetes at 60 years, there is a possibility that you have a health promotion, you have a better lifestyle, you exercise yourself, you eat a good diet, you don't go for a bad diet, you have maintained your body contours, you have maintained your exercises, your body inner body. Diabetes, we call it as a disease of early aging. Remember, diabetes is nothing but a disease of early aging. So you have an atherosclerosis, early aging, which is happening. So your aging happens at 60, 65, 70. You may get a diabetes at 60, 65, 70 if you have a good lifestyle because of your genetic inheritance. Diabetes is not a problem. Complications of diabetes is a problem. So we all know 15 to 20 years after you have a diabetes, complications becomes very common. So if you have your 60 to 65 or 70, you have your diabetes, another 20 years you develop a complication, your quality of life is improved, and your disability adjusted life years becomes decreased. You will go to 90, 85, 90, you develop your complications. Or you may not develop still another 20 to 30 years. So the complications, your life becomes so improvised and quality of your life becomes, and you're not a burden to the country or a public as such. But if you are not maintaining, what is happening right now is our lifestyle has become so bad initially, and we continue to have it as a bad lifestyle, that you develop diabetes by 30, 35. And by 50, 55, you are having a complications. Much earlier to that only, you have complications. And you have to live with another 30, 35 years with that complications, which is a burden to the health system and also burden to the public, because health system is again contributed by the public health system. So the whole burden is increasing so badly because of your non-prevention. If you could prevent the initial part, the primary prevention, from primordial and primary prevention rightly at your adolescent, having a good diet and exercises, and do not have habits like smoking and alcohol. Do not, and if you know that by chance your body is increasing because of many other, body contour is increasing because of many other aspects, decrease it, bring it to increase your exercises. You have your primordial prevention. You can postpone your aging for few years. Aging has to happen. Similar, like all of us know, aging has to happen. It is the truth. Similarly, if you are having a genetic diabetes, is the truth. But you can postpone your diabetic condition for a longer period, and hence your complication for much longer period.
Ma'am, once a person develop a diabetes, like a person have diabetes, then will he take lifelong treatment, or if he can prevent, like if he manages lifestyle in a proper manner, then he can control it?
Yes, initial glucose intolerance, in initial period of time when it is in a borderline, that we call it as glucose intolerance, can be managed with the lifestyle. So what happens is pancreas, all of us know again, the pancreas, because of a pancreatic disease, your insulin, one of the hormone which is being produced, is less reduced because of fat accumulation or a damage in the pancreas because of many other things. So when it is reduced, then there is a reduced production of insulin in initial part when it is not much damage. When it is reduced, if you maintain your lifestyle, if you make your life a better way of living, you can definitely control and postpone it. That's what I'm saying. You may get it later, but you can postpone it, you can maintain it. But what happens is, means if you reduce the stress on your pancreas, overall your stress on your pancreas by hormones and by fat, you reduce the stress on your pancreas will work better for a longer period of time. But you've not done that, it will get spoiled much earlier. So it will need a drug, it will need an external help for making up the insulin, which is a part of body metabolism. Till we live, we need body metabolism, and insulin is a part of that body metabolism. So what happens is, if you are not maintaining it, the initial part, yes, but once you have your pancreas is so damaged that you need an external help, then only lifestyle is not going to work out. Of course, reduced drug intake can help it. You can remain as an oral diabetic, or you may not go to insulin intake. But once it goes to that level, reversing is very, very difficult. Reversing and regrowth, because all of us know pancreas coming back to its own status is quite difficult. You may need a lot of improvement for that. But initially, if you even the secondary prevention, that means once you are diagnosed, once you know there is something going to happen, you are maintaining it, you can still do it with the lifestyle.
Okay, so basically, what are the important tips to prevent the diabetes?
Yeah. First thing I would always want is, see, we cannot say that we cannot ask for whom we are born. So what is our genes? We cannot determine. What we can determine in our hands. So diabetes has non-modifiable and modifiable risk factors. Non-modifiable risk factors are genetics and your age, and again you from where, like your race, because Asians are more prone as compared to Caucasians. We cannot change this non-modifiable. But modifiable risk factors, which are many, can be done from the beginning. That's we always see our adolescents and the schools are not giving much of importance to the sports or physical activity or any type of other ways of life. All of us know we have become more lazy over a period of time. but our eating habits have not changed. If you see culturally, our eating habits have become more because we are nutritionally, we are getting more food. So we are eating more, but because we have a lot of vehicles now, our roads are better, we are working less. Means physically we are working less, mentally we may be working more. So physically we are working less. That's what is happening from the childhood. We are working less, physically we are working less, we are eating more because we are becoming more and more developing, and we have more and more food, and that's why we are giving them the food. Better foods, more of fat foods, and we are getting. So this reversal has to happen. Our food balance and our physical activity in balance from adolescent, from childhood, from as a child has to be developed. A good habits of these has to be developed. We have, because there is an access of lot of things for drugs or smoking or alcohol, the access has become so open because we get information everywhere. Information is there and access is there. Access has become, it's become so very common. So that has to be inculcated in the people that this is not for one time, it's going to be a lifetime. If you're going to develop this as a habit, it's going to be a lifetime. So those healthy habits inculcation, and most of our adolescents and adults do not know where to use their energy. So they are using their energy in unwanted things. So using drugs or alcohol or smoking and eating a lot because they think that is what they can do. That is what is the fun, because they do not know. So those healthy habits, understanding, developing and stress. We are using, as I said, using our mental work is becoming more. And what we call is that stress. Stress is not the way, it's not that anybody does not have a stress. Everybody has a stress. A stress was there earlier much more because there was no food. But how you manage the stress is very important. We have all become in life too demanding. We want everything to us. We want all the things. From the childhood, we have developed them in such a way that we are in a rat race. We want everything. So this is the management of stress is becoming difficult because we want everything. The wanting has made us more stressful, which in turn acts on our pathways. So these management of ourselves, management of our mental, if you know, the earlier people were more happy. The happiness, and now we made it more materialistic. Rather than making it internalization, we have made it more materialistic. So teaching them over a period of time, even in an adult life, even in an adolescent life, to internalize the happiness, to eat well, that time you don't feel like eating too much. The materialism itself made them feel that by eating this I'll become happy. By sitting simply, by seeing TV, by seeing so many things, I'll become happy. You're searching happiness, but you internalize the happiness. Lot of your lifestyle modification. Lifestyle modification is just not exercise, just not food, but also internalization on self-realization, self-actualization is more important, which we have to go into picture. There, yoga, meditation comes into. Yoga and meditation are not a treatment part, but they help in prevention because they help you to internalize or actualize your feelings. That's very important where it helps you. So it cannot be as a treatment part, but it definitely helps as a primordial and primary prevention. So
So,
that's the
ma'am,
prevention. Huh. Yeah.
what is diabetic diet and what's its importance?
Yeah. Once you're into the diabetes, you have a disease. First important thing I said is the diet. Every time, it's one very important thing in diabetes is not to reduce completely or not to increase. That's why I said your pancreas is not working properly, so aptly. So you have to help it to work aptly. So what you do is you take a meal in such a way that whatever the production of the insulin of your pancreas will be helped out, because for metabolism of what you eat you need insulin. So your pancreas, how much insulin it is creating, you should help it out. When it is creating, you should help it out. So don't eat a bulk and make it give a stress to the pancreas to create a lot of insulin. It will get, first of all, it's damaged and you're creating more. So small meals in between will help your pancreas. So that is diabetic meal. And don't eat too less, because again it has one mode of production and you are reducing that, and all of your body reduction will reduce. And what happens when we eat less, our body accumulated fat has to be converted into energy. We require energy. So conversion of fat into energy requires more insulin. It's again a stress on the pancreas. So eating how much your body required in small divided meals is called as diabetic meal. Of course, there is a process in which the things will be given, and there are foods which are having high glycemic index or low glycemic index. Means high glycemic index require lot of insulin, low glycemic index require less insulin. So do not eat high glycemic insulin, which can cause a pressure on your pancreas, but eat low glycemic index, which can help your pancreas work better for a longer period of time. So that's one major important in a secondary prevention. Second thing is, if you are on drugs, if you're started on drugs, take your drugs regularly, on time, without missing, because that is a help, external help your pancreas is getting. Don't overburden it. You may say, today I have reduced, so I will take, and don't overshoot it. There are a lot of people who say that, okay, I'll eat one sweet today, I'll take two tablets today. That is not the way how it is working. So it's very, very important that you should not change your diet, because your pancreas is already troubled. Don't trouble it more. By giving two, you are not doing anything. Again, you are actually putting a pressure on your pancreas. You should not be doing that. These issues has to be, so you have to have a sustained life. This is very difficult for all of us. We cannot have a institutionalized life. We cannot have a timetableized life. We all want to go away from it. But once you're a diabetic, you have to maintain a timetable, institutionalized life. That is again another part of lifestyle modification. You have to maintain, and exercises, other things, so that you have to postpone your more aging. The more you age, your internal organs are more damaged. So you have to postpone your age. So you have to exercise so that your antioxidants are produced, your atherosclerosis reduces. You have to postpone. The more you age, you get more complications. So early aging has to be delayed. That's the one major part all of us have to remember when we are already a diabetic.
Ma'am, please suggest some examples of low glycemic indexed food a person
Okay.
should eat.
Low glycemic index food, like exchange of things. It's not like it's a permanent. See, like millets. Most of the millets what we take, what we eat, are low glycemic as compared to rice. Other millets like small ragi, wheat is also lesser. Ragi is the least one. Like if I go into the major meal, so those things. So replace your food in that such way. That is one thing. And fruits, when we look into, high glycemic are banana, mango, all these are. Whereas watermelon and other things which give you, which do not have very high protein or high diet contents, are like, you do not eat too sweet things. Mango, chiku, and banana, these are high glycemic. Other fruits like papaya, watermelon, these are quite low glycemic. So you have to eat fruits. Don't eat too much of fruit also. Less of, because again glucose, you know that they have a high fructose. Fruits have high fructose. So, but you eat a lesser glycemic, and always eat half. Whatever you are eating, eat half of fruit, or eat half. How much of a papaya others eat, you eat half of it, because you're diet. You cannot afford to have as much as they are. So normally we say like mosumbi or whatever, half of fruit, even apple, half of fruit, and don't eat like banana, mangoes, or jackfruit or something which is very sweet and very nice, looks nice. So you have to control those things, part of it. And all of us know, why should we avoid sweets? Sweets has majorly only large amount of carbohydrates. It's not only just because it is this. So one laddu can contain around 300 kilocalories, but it will not fill your stomach. And you have to, one meal, our meal is around 280 kilocalories, and one laddu is around 300 kilocalories. Can we sustain with one laddu and not eat the food? It's not possible. So what happens if you're eating the food and then laddu, you are actually having double the time. So you should not eat that sweet. Why it should not be eaten is, you have to reduce the burden on your pancreas, so you cannot afford to have it. If at all you are eating, you have to reduce. Even though if you are eating a small piece of laddu, you have to reduce 1/4 of your meal. and then you may again feel hungry. So maintaining these parts is going to be difficult. That's why we say avoid sweets. Don't eat sweets. So that's the major things. All these are high glycemic. Rice also, because of that, high glycemic, you should reduce it. It's going to be very possible. You feel hungry. So eat less glycemic, like ragi, like wheat and look other things. But don't eat too much. And more, normally what they say is sometimes the people who are used to, like for example, somebody from north who is used to eat some 7 chapatis, they tell them to eat rice. Not because of glycemic illness, because when you are not used to eat rice, so you eat less rice. If you are chapati, that's a satiety center it is, because I'm used to eat 8 chapatis. I feel happy after eating only 8, but I can eat only little rice and feel happy. So that time you reduce on that variety is being given, so that you reduce on and you feel happy. Whereas in the south, people like to eat a lot of rice. Then they tell them to eat 2 chapati. That is because even though you eat 2 chapati, they feel okay, it's full. The satiety center is filled because when you eat rice, so much of rice is required. But when you eat 2 chapati, it becomes lesser rice. So the satiety center to say also you have to change your diet. What you're normally eating, you have to reduce, and it's going to be difficult. So you have to have a variety. You should have dal, you should have variety things to feel that you're full. Your stomach is not that just dependent on what is the need. It is also on your satiety center, like how you feel good after meal. Like all of us feel good after eating chocolate, and that is a satiety center. We all feel good. That feel good factor is more important in food, and for that we work on. So that's why they say eat a lot of vegetables before you start the food, so you feel your stomach is full. So eat not only with the food, initial of the food, eat a lot. Diabetes should eat a lot of vegetables. They start feeling their stomach is full and they can eat less. If they eat food, then they cannot make it for the vegetables. So that's why start of the food should be with the vegetables, so that you fill your stomach. And vegetables should be such that which are water filled vegetables, which can fill your tummy rather than other things. Like you make feel that it's like brinjal, like more of which does not have any calorie, but it is all water filled vegetables.
Okay, ma'am, let's close the session with the last question. Please tell us about the public health importance of diabetes mellitus and your few tips to all the people who are watching this video.
Yeah. Public health importance. As I told you, diabetes causes a burden of disease not just to the individual but as whole for the society. Because number of diabetics increases, it is not a communicable. It will not spread from one to another. But taking care of them is a big problem within the house. Also, the health system has to work in multiple ways to take care of these people. So longer the duration with diabetes, higher is the burden to the society as such. You may think I have diabetes, but you remember that you are also being burdened to multiple people in multiple ways if you're not managing it well. So you are increasing the burden of the disease in the country, and country's economy will be in a problem because of this disease. So the public health importance is as the disease increases, the disability adjusted life increases, and because of that, economy of the country is affected. So in whole, we become more poor, and because of which more diabetes comes in and it becomes a cycle. That's the public health importance of diabetes if it's uncontrolled, not appropriately controlled. The tips is all of us have to remember this is a disease which not only includes your physical health but also your mental health. So first thing in life is to be happy, learn to internalize your happiness and bring in a institutionalized, a well-maintained lifestyle throughout your life. It's easy to get and happy, like just sleep around, not do anything. But you also should remember that that's not going to give us a longer run. So we should have a good physical activity, and your physical activity should be your routine, and your good diet should be a part of your everyday life. From you, your children learn, from them, their children learn, and that is how the world will grow. Thank you.
Okay, thank you so much, ma'am. It was a very interesting session with you, and thanks you once again on behalf of all the audience for connecting with us.
Thank you.
It
Thanks a
was
lot.
great
Ritu.
talking to you, ma'am. Thank you.
Thank you.